All right, we can go ahead and get started. Thanks so much, everybody, for joining tonight. And I have the privilege of introducing CJ Christian, one of our genetic counselors here at MCW. So with that, I'll let you take it away, CJ.
Hey everyone. Thanks, Melissa. As Melissa said, I'm CJ. I am a cancer genetic counselor with Frederick in the Medical College of Wisconsin. Myself and other cancer genetic counselors help provide genetic counseling services through the Frederick Cancer Center. And that might include individuals who both have a diagnosis or history of cancer and those who have a family history. So what I'm hoping to do, and this is my first year doing this, so I may have done things a little more briefly than I could have, but my hope is to give everyone just kind of an overview of genetic testing and counseling for those who may not be as familiar, and tie that into pancreatic cancer and why that could be important. There we go. But today happens to actually be Genetic Counselor Awareness Day, so it kind of fits well. Um, the genetic counseling, kind of the historical definition, is that it's the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease, as you'll see on the left. So, as a cancer genetic counselor, my role is really to enact that in the cancer setting. So, helping people with risk assessment for cancer, understand the genetic testing process to help look for genetic risk factors related to cancer, and helping individuals and their family members, both in the medical and scientific part of it, but also the emotional side of it, and results. What is genetic testing, as I've kind of thrown that out? Genetic testing is really the process by which we're analyzing genetic material. In this case, genetic material we've inherited from our parents. So genetic material gets passed through generations. And from our parents, typically, we all get our genetic material through genes. And half of our genetic material comes from each parent. And these genes are the packets or codes, if you will, for bodily functions. In the cancer setting, there are particular genes that we are focused on. So we are thinking about the testing option to analyze various cancer-related genes and really looking for mutations or harmful changes that would then impact somebody's risk for cancer. Hereditary cancer risk is something I'll get into in just a minute, but this can be something that some of you may or may not have done, or know of people who have done. Um, and a couple of the most common examples, I would say, the most well known in the media anyway, are the BRCA genes, BRCA1 and BRCA2. Some people like to refer to those as the Angelina Jolie genes, because once upon a time, as a celebrity, she did testing and made some medical management decisions based on those. And those are not the only cancer genes. There are going to be many others that might be tested in a sitting. A lot of people do ask me as well, if I'm going to go do genetic testing, what do I have to give? What type of sample is this? Am I doing a procedure? The answer is it's really just a routine blood or saliva sample in most cases. I put an asterisk there because there can be some exceptions where that might not be a good sample. That's something that, as part of kind of the genetic counseling process, um, would be kind of assessed by the genetic counselor and discussed. But for most people, it's going to be a fairly routine sample. Why is genetic information useful and how can it help? In a lot of cases, these are the main reasons that people go through this process on the right-hand side. For individuals who have cancer, especially pancreatic cancer, though many others as well, this may very well help with treatment options and decisions. Um, oncologists are really trying to target genetic testing information to help with some of that. It may also help explain some of the cancers in a personal or family history, as well as understand future cancer risk. And with that future cancer risk understanding comes the potential for changes to help manage future risk for cancer. So, as a lot of what I do is all about risk. Risk don't always develop cancer, but they may need to be more watchful. That may lead to discussions about some risk reducing and, risk reduction and screening. And then this information can be very useful for family members as well. Part of the hereditary nature of what I do means that if there is a genetic risk factor, it often was passed through the generations. Um, and could be passed on in turn. And it looks like my camera turned off for some reason. I'm gonna try and oh, I think Melissa, maybe you stopped my camera, which is okay. I can keep going. I just
Oh, it looks like we had a disconnection. I see Dr. CJ. Sorry about that, CJ.
oh, no problem. Okay, I got back in. Let me share. Let me get back to my screen here. Okay, there we go. Okay. All right. I'll kind of jump back in. I think I maybe cut out when I was talking about family members and information for family. So there are many, many different implications to getting hereditary risk information. Important to know about hereditary cancer risk. You know, we're really, as I alluded to, looking for a higher risk for cancer, a genetic risk factor in families. So what it is a genetic predisposition. What it is not is it is not itself a cancer diagnosis. So if individuals do testing and let's say we find one of those harmful changes, one of those mutations, it is not itself telling somebody that there is a current cancer or that they will for sure develop cancer, but it could mean a higher risk, which in turn could lead to the need for some of those changes alluded to earlier. And then it may not be the only risk factor. The vast majority of cancers are not due to hereditary components and are not identified with genetic testing like this. There can still be other risk factors with or without genetic mutation found with this type of testing, whether that be through lifestyle or exposures or other risk factors as well. So just to kind of give a little bit of an overview. So how does this tie in with pancreatic cancer? I see a lot of patients who have pancreatic cancer. There are a couple big and main reasons for that. One of those is treatment is becoming a big factor. So information like this is very, very useful for oncologists in the treatment plan. Anybody with pancreatic cancer is eligible for genetic testing, though not everybody who comes to see me will necessarily do testing. That could be kind of a decision on a personal basis. About 15 to 20% of pancreatic cancers are found to be hereditary. So, to put that another way, if we do genetic testing, that is the approximate frequency of individuals with pancreatic cancer who will have a gene mutation found with their testing. So again, most people won't, but that number is actually a little bit higher than we see with other cancers, where we often will quote around 10% um, or so for other cancers like breast and prostate for comparison. What I have down kind of at the bottom of this slide is a sampling of the different pancreatic cancer genes. Um, if anybody here has ever done testing or knows somebody who has done testing or tested positive for mutations, you may recognize some of these names. But if this is really something that when we are ordering testing, we're often thinking about testing many of these different genes to make sure that we're not missing one particularly. You'll see the BRCA genes, BRCA1 and 2 off to the left here. While those are most well known in their association with breast and ovarian cancer, they do overlap with pancreatic cancer. And so those have been two of the really big ones that are tested in pretty much any pancreatic testing, pancreatic cancer related testing. But so are many of these other ones with the purpose of making sure that when we're offering testing, we're not missing crucial information that could really be informative. And all of these genes are going to be different. So they're really not one size fits all. Some of these genes will overlap with other cancers of different types, and that could in turn inform what other cancer risks are going on. I did include in here, kind of off to the right, there are two different types of pancreatic cancers, as some of you, if you've, I'm sure this may have come up in some of the other discussions these couple of weeks, or maybe not, but there are two main types of pancreatic cancers. There are the exocrine, which are the ones that people maybe most think about, the more common of the two types. And many of the genes and most of these squares will be related to those pancreatic cancers, the ones that are related to the digestive enzymes. But in the last square here on the right, I did want to make sure that I included those that are related to pancreatic neuroendocrine cancers and tumors, which can, in some cases, though not always, be related to secreting hormones. And so those are more hormone-related tumors, and the less common of the two types of pancreatic cancers. Those are a very distinct set of genes, so they are very differently characterized from the other cancer genes that you'll see on this slide. And so sometimes when you see a genetic counselor, part of the discussion will be around which genes are appropriate based on the type of cancer that somebody has, either in an individual or their family members. And like I said, a lot of these are often lumped into one genetic test at a time. So that's just a little overview of some of the various things we might be doing. Sometimes genetic testing will get broader than this. I won't go into details here, but sometimes when people are doing testing, they actually will test for a broader amount of genes, even outside of pancreatic cancer. And that is something that, if you find an interest in that, that is something that could be discussed with a genetic counselor. So to kind of take things home a little bit, if you do have pancreatic cancer or a history of pancreatic cancer, testing may very well help you and for your physician with treatment options. That's one of the big ones. Targeting mutations that can be found in particular genes to really give a focused approach to treatment. But that may also help see if there's some sort of genetic explanation. So for those who are looking for reasons why this may have occurred, or at least in part see if there's an explanation, and understand future risk for cancer as well. And that could apply both for people who have had cancer and have not had cancer. And then also being informative for relatives. For example, if you have pancreatic cancer and you have children, information like this may be very, very useful for them to understand if they could also be at risk to inherit something and inform their screening options, and not just children, but siblings, brothers, sisters, or more distant relatives, aunts and uncles, nieces, nephews, etc. If you have not had pancreatic cancer, testing may help you understand the family history of pancreatic cancer. So if you see a genetic counselor because you do have a family history, The discussion will be to see if there is something that could explain the family history and help you understand your risk for pancreatic cancer, and if you might benefit from screenings for pancreatic cancer. For example, at Freighter, we have the Greater Midwest Pancreas Screening Program, which I am involved with from the genetic side, but screenings for pancreatic cancer, which are getting better, still young compared with a lot of the other cancer screenings, but something that can be very useful for those who are found to have a genetic risk or, in some cases, a strong family history, even without genetic risk. And then, of course, as applies in all cases, information for relatives might be found as well. I did want to give kind of a little bit of an overview for those who are not as familiar with genetic counseling. Um, some people often ask me if they come for genetic counseling, well, I came for testing, right? And the answer is often yes, you refer to talk about testing, but it may not always happen depending on patient preferences. So what does actually happen in the genetic counseling appointment? Usually this is the first step, I would say, to have a discussion about testing and be informed. And then a genetic counselor will often help in the ordering of testing and describing what that is. I like to think of genetic counseling as being composed of two main parts. The first part is really getting some information from you, personal medical history, reviewing that, making sure that everything is captured to help with the analysis from testing, but then also getting your family history information. So sometimes it helps to come to these appointments with a good understanding, the best that you can find out anyway, about your family history of cancers, the ages that those cancers have occurred. And that might not just be pancreatic, but other cancers that might tie in with some of these different predispositions as well. And then the second part um, could be education, really giving you information on the risk assessment. What are we suspicious for if we see cancers in yourself or your family members? What could that mean for you? In terms of hereditary risk, and then discussing the genetic testing itself, how it works, what your options are in terms of what sort of genes we want to look at, the cost and insurance for genetic testing. What are the limitations, the benefits, the risks for genetic testing, going through informed consent for genetic testing. And this might also include information on discrimination laws, um, possible results from testing, and how results are disclosed to you as part of this whole process. And it's not just all scientific and medical. A lot of these appointments will, as I alluded to earlier, include making sure that patients are supported through this process and their family members, the emotional impacts, and a lot of times there can be a lot of other things going on. So making sure that you are prepared for testing and that you're supported through the whole process. These discussions are really designed to allow you as the patient to make an informed decision on genetic testing. Um, Genetic counselors will never recommend officially genetic testing. We can talk about guidelines. We can talk about who might qualify for testing and who it might be appropriate for. But at the end of the day, it is really a patient decision. Making sure you're informed to make that decision on your end and understanding what the benefits are to doing testing. Um, so this is just a really broad overview. And then, like I said earlier, if testing is something that's done, that is something that your genetic counselor would help facilitate and go from there. But this is usually the first step. So to kind of give a very broad overview. What's next? If individuals, if yourself or family members are really interested, a lot of individuals are referred to genetic counselors by your oncologist or your primary care provider or even other providers as appropriate. So they may refer you, or if especially as the case, I can speak at least for Freighter, that you could self-refer for genetic counseling if you feel a strong concern in your personal and family history to really get the discussion going. And I did put the number on here for those who might be interested in scheduling an appointment. All we ask is that you kind of give a hint as to why you're scheduling, whether it be, I have a family history or I myself have been diagnosed. So this is something that you might consider doing, um, depending on what your concerns are, just to have that discussion. I really wanted to open it up more time for questions and answers because I know this can be very new and different from the other health disciplines. So I can open it up for questions if there are any.
Feel free to unmute, or if you don't want to speak, you can drop the questions in the chat as well.
Hi, I have a quick question. This is Melissa Irwin.
Hi, Melissa.
Hi. Um, my late husband had pancreatic cancer and was genetically tested at MCW. And since his passing, another additional family member was diagnosed with pancreatic cancer, and his mom developed and passed away from colon cancer. At the time, it came back inconclusive that there were no genetic mutations. But if we've had more kind of findings in his family tree of cancer, would I be able to meet with a geneticist again just to review everything? I'm assuming, I mean, they still have his records there and everything, to go through it. And I have all the hard copies of the genetic findings.
Yes, absolutely. And it sounds like you have the information, so I can kind of provide some guidance. You can absolutely meet with a genetic counselor to review things. Family histories do change. Genetics is a constantly evolving field as well. So
Mhm.
we do learn about new genes, and the technology may change over time. And so we do encourage people to revisit genetic counseling. Um, a lot of times it's described as a kind of one and done, and nowadays with testing it often is, but when family history changes, we do suggest following up with a genetic counselor. And it sounds like you have some of those records. So what would likely happen, Melissa, is that you would be asked to provide maybe those records, or give permission to review your late husband's records to just check those old results,
Mhm.
see what was done, what that encompassed, and the results, and make sure there haven't been updates. And then what they would go through is get those family history updates from you and see what might or be appropriate. And even if that doesn't lead to new testing for you or family members, then still making sure you have up-to-date information.
Okay. And then based at that moment in time, and this was probably about 8 years ago. So I know there's been a ton of research changes. But at the time they said for my son that he should start screening 10 years from the earliest family diagnosis. So my husband's father was diagnosed at 45. So they said my son should be starting to get screened at 35. Do you know if any of those screening processes have changed based on family history?
And I just want to clarify, are you referring to like pancreatic cancer or colon?
Pancreatic, no,
Pancreatic.
pancreatic cancer.
Okay. So the the there are two ways to answer that. One is the pancreatic cancer screening could really depend a lot on how many family members total have been diagnosed. But yes, that is still the general guideline is 10 years prior, or the age of 50 for the majority of cases. And I will put a little asterisk in that could depend if there is a gene mutation in the family that could change that timing. So it isn't necessarily the same 10 years prior for everybody. That's kind of a general outline. Sometimes it's earlier or later, depending on what sort of genetic risk factor we're seeing, if there is one. If it's just based on family history, then that is still the general guideline.
Thank you.
Absolutely.
I think Patrick had a question, and then we've got a couple questions in the chat
Yeah.
that I can read out.
Oh, I do see them here. So I'll kind of start with the earliest one I see. Do you recommend genetic testing for kids when one parent was diagnosed with pancreatic cancer? Yes. That is a situation where a child, in that case, would meet guidelines for genetic testing. If a parent was diagnosed with pancreatic cancer, we would say any first degree relatives who have had pancreatic cancer, so parent, a sibling, or a child, their first degree relatives would qualify for genetic testing. And certainly, if a parent is available for testing, they might be a good candidate to do that first. But in cases where that's not an option, then yes, children. How do you usually approach family members of a pancreatic cancer patient to do the testing? From your experience, what are the challenges usually encountered in recommending or doing such testing? I'll try to get at what I think is the gist of this, and if I don't answer it properly, please follow up with me. But um, so I often will start by, I do the same that I would do with anybody, taking a very thorough family history, making sure that I understand what the situations are with family members, because sometimes family members are available to do testing, but they may not want to do testing, even if they have cancer. And so I try to understand the bigger picture of what's going on. Um, in my experience, some of the challenges can be really dependent on family dynamic and how family members are doing. Individuals with pancreatic cancer can really range in that they may be very ill or not interested in testing, or they may be geographically distant from other family members. And so I try to gauge all of that and really have a careful discussion about what might be an option to get that information, understanding that when I'm seeing a family member of somebody with pancreatic cancer, timing could still be a factor for them, that they may not want to wait for testing to get this information. I will always, always counsel the most informative individuals to test in any family. And this could apply to pancreatic cancer, but also other cancers. But it's going to be those individuals who have had cancer. They are the best people to test first, because that's the most informative approach to see if there isn't a genetic explanation behind somebody who has had cancer, to kind of inform the risk assessment for those who haven't had cancer in the family. But again, that is not always an option. So really getting the fuller picture. The challenges can really range in terms of, do we do testing right away, or do we wait to try and get family information, if we can, from individuals who have had cancer? And of course, there can be other challenges as well, acknowledging that cancer diagnoses can be hard, depending on the turnout of those cancers for family members. So that's where a lot of the psychological and emotional implications come to play. And if I didn't do that question justice, please follow up with me, and I'll try to follow up on that. Okay. I think the next question here is, do you recommend, oh wait, I think maybe oh, okay, I apologize. I think there's a follow-up here that to another question. Testing the kids regardless of the result of the genetic testing of the affected parent. Okay, that's a really good question. Um, it depends is the short answer. If a parent tested positive for a mutation, then testing the kids is appropriate, because they're at risk to inherit that mutation. And that might be something to consider. If a parent had a normal genetic test and it was comprehensive enough to the genes that we would recommend be tested these days, then it may not be needed. But of course, we want to take all factors, such as if the kids have a family history on the other side. So it's the other parent, let's say, then sometimes if that other parent has a strong family history, there may be something more to account for. So it could really depend what the finding of the parent was, but that's a good question. Another question here. I see mother had uterine cancer at 62 and a sister with breast cancer at 46, and sister did genetic testing that was inconclusive. Do you need testing? It does not sound like it based on what I'm just seeing here. Again, I would say that maybe an individual review of what the sister's result was. A lot of times when we hear that results were inconclusive, I could maybe elaborate on that a little bit. So most people that do testing, they think of two results. They think of negative or normal, and they think of positive, where there is something in genetics. Positive might be a mutation, a risk increasing mutation. And then there's kind of middle ground where there's a variant, a change in a gene, but we don't fully understand what that means. In genetics, we call that a variant of uncertain significance. And when that's found, it often is considered inconclusive. It may mean that more studies are needed by the testing lab to better understand if that variant actually increases the risk for cancer or if it's just a normal variant. So we all have genetic variations and most of them are not harmful. But until we know one way or the other, when something comes up on the genetic test, we have to wait for more studies. In the majority of cases, uncertain results like that do not warrant testing in family members. However, the benefit to having the test result reviewed is that we can make sure that hasn't changed. While 90% of uncertain results are downgraded to benign or normal, there's that small fraction that do end up upgraded to risk increasing. And so we can check and make sure it hasn't changed and that it might not warrant testing. So hopefully that clarifies. It sounds like you would not, Pam, need testing, but if that is something that you're interested in, I'll make sure that I drop my phone number in here for folks as well, that if you feel like you have something more individual to be assessed, that could be done for you. And I'll just go ahead and, well, Melissa, maybe tell me, would it be better if I give you my direct phone number, or should I pop it in the chat? What would be better?
I'm happy to facilitate that. So everyone should have
Okay.
my email from the Outlook invites. So if anybody's interested, certainly reach out to me and I will be happy to provide CJ's information.
Yeah. Yeah. Is there
Any other questions? Good questions so far.
Yeah, definitely great questions.
It's Patrick. I'm the one who mentioned the ctDNA question, so I don't know if it's off the topic or if you have anything to say about that, CJ.
ctDNA question. I'm not seeing that in the chat. Maybe I missed it. I'm sorry. If you wanna,
I'm not sure if I put it at the right place anyway.
okay.
So I'm talking about referring to Signatera testing, for example.
Oh, okay. So you're asking like if that's something that we do with our kind of scope? Yeah,
exactly. I don't know if it's the right forum right now to talk a bit about that, but I'd be curious.
Yeah, that's a really, really good question. So the short answer is I actually do not do a lot of Signatera. There are the genetic testing that I focus on is when I say hereditary, that I guess the very, very technical term is germline testing, and that refers to testing of the genes that are going to be expressed in kind of the full body picture, if you will. So because we are all products of our biological parents, sperm and egg, what are called the germ cells. When after conception, that kind of composes what we call our germ line. So we do germline testing to see if have inherited mutations. Some of the ctDNA and other testing is often actually done by the oncologists themselves, at least at Froedtert, and it does vary by institute, but there are other types of tests that physicians will order to help inform treatment options. So that can encompass, Patrick, what you were saying, things like ctDNA, so that's circulating tumor DNA that the tumor can release into the bloodstream. It might also include what's called somatic or tumor testing, so sample of tumor tissue itself where the cancer is, that can kind of go through its own genetic analysis, because these tumors are often encompassing mutations. They're not necessarily inherited, but these mutations can lead to the tumors, and that information can be useful for treatment purposes. So there are many other types of tests that people might go through besides the hereditary testing. I just don't order anything besides the hereditary testing myself, but hopefully that addresses that. Does that kind of address, Patrick, what you were asking?
Yeah, thank you. So then it's interesting because I had a screening after my cancer, and it was done on the original tumor. So that your answer tells me that it wasn't genetic testing I had. It was just the testing on the tumor itself, not from my germ cells.
Right, right. And that actually, Patrick, is a really, really good point to bring up, that sometimes if you've undergone some sort of tumor or circulating tumor testing, it may or may not have findings, and it does not always it does not, I would say, preclude still needing to do a germline test or hereditary test. We can use I will say on our end, we can use information from tumor testing to kind of help inform our suspicions that there's something hereditary. So that information can be very useful, but it is very distinct as well. And vice versa as well. People who have germline studies, whether or not there's a finding, may still benefit from tumor testing. So that's a really good point to bring up. I do see another question in here from Terry. Are you anticipating any discoveries related to PC? And I might ask for clarification on what you mean by PC, coming from the All of Us research effort.
I think it's pancreatic cancer.
Okay, there we go. Duh. Okay, got it. That is an excellent question. Yes and no. I guess All of Us is not something that I participate in directly, so we don't consent people for that research, but we are getting a lot more individuals who are coming to us after having findings from that research study. So a little bit of background for people who may not be familiar. This is actually a national research study that is being put out to help people understand a broad range of health information, and cancer genes are a part of that. And so toward that end, we could be learning a lot more about individuals who are having mutations in pancreatic cancer related genes, at least the ones that are encompassed in this study. The limitations might be that it may not cover necessarily everything that we know about cancer, pancreatic cancer, and it's hard for me to say what sort of information they're actually getting on the clinical side. So for example, when we do testing, we want to make sure the testing labs know about the type of cancer somebody has and the age that somebody had that cancer, because it informs the analysis that's being done. I can't really speak to that sort of information that they are receiving, but I would anticipate that over time, it will really help us understand the risk factors and the better inform the risks for cancer, the more people who are tested. So I do see improved information, and I also know that All of Us is trying to get better information on people across a range of ethnic backgrounds and understanding some of those more, those aspects of risk factors. And so that is something that we'll look for improvements as well. And those that do have a finding from all of us, usually the next step is to have a clinical confirmation test with a germline, a clinical lab that confirms that. But that's a really good question.
All right, any last minute questions, anybody? All right. Well, thank you so much, CJ, for taking the time to speak with us today.
Well, it was my pleasure. Thank you.
Thank you, everybody, for joining. Everybody have a good night. Bye-bye.
Bye.